We have another well-known functional medicine practitioner as well as a functional laboratory medical director, Dr. Patrick Hanaway from North Carolina. Again, we have Dr. Stephen Barry here. Today we're going to talk about Dr. Hanaway's personal experience in functional medicine and also talk about clinical laboratories work for functional medicine, why we need to do lab testing, how important they are. So first of all, I would like to ask Dr. Hanaway about when and why you got involved in functional medicine.
Well, thank you, James. Thank you, Stephen, for inviting me to be here and talk with you. You know, it's interesting because when I went to medical school in the early 80s, I thought I was going to be learning about health and how to keep people healthy.
Mm-hmm.
And
we all thought so.
I was really surprised and a little confused because I learned and studied biochemistry and thought that, well, biochemistry is what happens in the body with the foods that you eat. But when I went to medical school, they didn't seem to relate it to the foods. So I began a journey there, and one of the first books I read, Applications of Clinical Nutrition by Dr. Jeffrey Bland in 1983.
Well, that early? I didn't know that Jeff started writing books that early.
That's when he started.
So it helped me to see, there's someone, maybe I'm not crazy, and there's a view here. And so I learned about nutrition, and I learned about different kinds and approaches to healing while I was in medical school, and that was very reassuring to me. As I went through doing various public health work and having an opportunity to do my residency, then I went and did some work in India. And as many people who have gone to India before me, I got filled with parasites.
Oh, wow.
And I tried many different kinds of medicine and approaches, none of which helped. And then a friend of mine, a teacher of mine, said, you should check out this lab in North Carolina, and they can do some special testing to look for parasites. And they found them, and I was treated, and I was better.
Wow.
And that was my first exposure to functional medicine testing. I was the patient.
What a connection.
I didn't know this story until a few days ago, actually.
Oh, Dr. Barry should be proud of that. Wow.
So when I was...
but then you were not living in Asheville?
No.
Okay.
So we moved to the Asheville, North Carolina, because my wife, who's also a doctor, wanted to train there. And as I did, I began to meet some of the people at the laboratory. But what I found then as I started to see patients is I had an understanding of nutrition and some other kinds of approaches to help people. But the people who were coming were really sick. And in my toolkit, I didn't have enough tools to help them. I said, I need to find out what's going on underneath this. And that was when I began to look at, if I can understand what's happening with their digestion and their nutrition and their food allergies and their hormones and their stress, actually I all of a sudden had tools that were able to help them. And so I had the tools, and I literally just applied what the tools told me to do. And the patients started getting better.
That was before you
This was
were
in the late
trained by IFM.
That's right. That's
Okay.
right. Well, I was trained by the laboratory, and that was in 1998 and 1999 when you were the medical director of the laboratory.
Before that, we composed a lot of good materials, a lot of clinical stuff, in material that we've been doing training all over the country. So, this is actually a very good sign, here that we are in China. I basically reinvented the wheel here. We got a laboratory. We got all kinds of educational material based on laboratory testing. So your experience is so important. We may be able to train physicians based on laboratory testing as a tool.
As a way to start.
As a way to start.
Absolutely.
Then they can move up from there. Yeah.
Great Smoky's lab was training physicians before IFM was started.
Good.
Yeah.
Yeah, I'd like to hear this story.
Yeah,
Wow,
so
good.
there was an educational program then called Achieving Clinical Excellence, which was the formal training program, but I had the informal training program, and that was, I had a patient, I ordered a test, I called and said, help me with this, and they would tell me how to understand it, and over time, after seeing pattern, then pretty soon they said, well, you seem to understand this pretty well. Maybe you can help teach about
Wow.
it. And that was, I began to teach for the laboratory, and then a little more time passed, and they said, well, maybe you can help be the medical director after you left. And that was how I got into doing that, and it's given me a platform both to teach and to learn,
Sure.
but also to develop new tests
Sure.
and say, how do we integrate, as Great Smokies was started and then Genova, how do we integrate the teaching into the test? How do we make it easier for the practitioner to be able to understand how to apply these tools?
And that's a new role for the laboratory, correct?
Yeah, absolutely. And that was part of the patient-friendly, colorful, simple representations were ideas that the lab had been doing them for 15 years before. People like Saul Werman and Ted and people started saying, oh, maybe we should start doing some graphical representation on lab reports, and yet we still see that most laboratories don't do that at all.
Amazing.
Yeah.
That's right. Yeah, I honestly, I think I was so amazed when I first, went to the laboratory. I see the report. I said, "Gee, this is something really amazing to the patients." Even a simple lab testing, if you have some explanations with color, those graphic stuff, patients will appreciate. And this is all invented by this gentleman.
Mm-hmm.
So I'm so glad that we
With a
have
good team of people.
we have this kind of talking here. This is quite amazing. Just by itself, just by
The three of us together.
people that have been in one small town.
Uh-huh.
Not
Far away from China.
yes, not probably 1% of Beijing population, right?
Oh, not even.
Not even 1%.
80,000 people.
Yeah, no traffic, good air. Anyway, I think it's quite amazing. I'm so thrilled that to have you guys here just talking about this. Now,
Well, and I think an interesting thing, of course, is so that's how some seeds were planted back then, and now we come full circle to today and see, what Patrick is doing in terms of being part of the faculty, and now I guess the education director for the functional medicine. So taking these concepts and now how they're now being taught to hundreds of thousands of physicians around the world.
yeah, we congratulate you for becoming medical director of medical education of IFM. This is you're going to create much more good educational material and a lot more impact on physicians all over the world. So that's very important.
You said this. It's like
Yeah.
the education of the physicians and the certification of that, helping to have a clear curriculum. That's
Right.
an important thing. And then, as we've heard recently, like doing research to be able to support it, and how does it integrate with traditional Chinese medicine, and be able to take a functional model
Right.
to be able to show that we can use these tools for patients with complex chronic disease, with symptoms that we don't really understand, and with helping to keep people well, which goes back to the beginning of my story of why I went to medical school. And that's what's really wonderful about it, is now I get to do that, and I get to teach people about that. And then of course I'm doing it in practice as well, and that's where the humility comes in, because it doesn't always work the way it says in the textbooks or the teachers tell you, but that's where you learn how to be able to really be a good teacher and a good clinician.
Yeah, that actually raises a great question. Why you go to medical school? What was the what was your initial thinking? you apply for graduate medical school, is that certainly that's much harder to study compared to other college. And after all that, then have you really achieved what you want to do at the beginning? This is actually a great question to ask physicians, and that can bring them back to the new model that we set in functional medicine. Maybe that can be, most of physicians probably think the same way as you did. Want to keep people healthy, and they went to medical school, and they learn, and they end up with not doing the thing that they wanted to do.
Yeah.
And being frustrated
And
for
being
much of their career.
frustrated. Yeah.
I don't know what the data is like in China, but I've seen research both in the United States and South Africa. In the United States, 2/3 of doctors want to quit medicine because
Oh.
they're not doing what they want to do.
2/3.
2/3.
That's quite amazing.
In South Africa, it's also 2/3 who want to quit what they're doing, and they've looked even further, and only 5% of doctors like to be a doctor, enjoy being a doctor. 1 in 20. And if that's what your doctor's feeling like when you go to see them when you're sick, that's going to get in the way also. So here we have a set of tools that can re-engage doctors. I hear this all the time. Gosh, I'm feeling like I'm learning medicine and doing medicine for the first time, and my passion is back. So I just feel really fortunate, and I'm so glad. It is very interesting, small world, that here we are sitting in Beijing, China, right?
Yeah.
So 15 years ago, we'd be sitting in Asheville, North Carolina. Now we're sitting in Beijing, China.
Yeah.
Bringing this course here, being able to bring this to the people of China.
That's amazing. Now, so three of us has been in the laboratory business. You are the most recent one. From your point of view, also being a clinician, why we need to do laboratory testing in the first place for patients?
Well, what we see is that when there are imbalances that are occurring before there's a disease, there are changes biochemically that are going on in the body.
Sure.
So if a person has a small amount of inflammation that's going on, they may have that going on, and that may manifest depending upon their constitution as to whether or not they're going to get inflammatory bowel disease or rheumatoid arthritis or metabolic syndrome or diabetes or cancer or heart disease, many things that can arise from that. If we can help that person to deal with the inflammation, that's great. Now, the other side is that if we're dealing with someone who already has disease, like heart disease, well, is that heart disease related to the inflammation? Is it related to nutrition and cholesterol? Is it related to stressors that are going on? Is it related to hypertension? Is it related to their diet? So the disease doesn't really tell you what the root cause is. And when you go to the root cause of a disease, or if you're dealing with someone before they have disease and you can find out where their imbalance is, you can treat that earlier. But you need to have some kind of testing. There's no crystal ball that says, well, what do you have? And I see people who say, oh, you have this, and it's like, well, you're just making it up. Like, let's work with science. Let's work with the data. Let's do the testing. Let's find out where the imbalance is, and let's treat it. And so a friend of mine, has a cartoon where she says, this isn't rocket science. And it's not. It's just following what the body is telling you. But in order to follow what the body's telling you, you have to listen. One really good way to listen is to be able to look at the body fluids, at the blood, at the saliva, at the urine, and also to understand what the genetic predisposition is, the genomic basis of what's going on. Because the three of us, may respond differently to a certain challenge of, say, salt, or a high-fat diet, or a high-carb diet. We're different. And that needs to be taken into account to be able to personalize treatment for the individual. And, this is not, as I said, a conceptual idea for me, because this is just what I did and it worked. So it's like, I try to say this when I teach, like, don't listen to me, just do it and see how it works, and you'll find that it works in your practice.
Wow.
Now, when certainly a way of measuring, if you will, when things are working, starting to work, is one, how a patient presents and how they feel. But what do you think of, how do you use laboratory testing to follow up with patients and follow their progress and determine if the intervention is working and appropriate, or if some modification needs to be done?
Well, we were you talked about that some yesterday. For example, generally with testing, I'm not someone who's testing someone all the time. So if I do the testing and the person is feeling better and they're doing really well, I don't need to keep testing them. But there are certain measures, like telomere testing, that can help you to see, well, where's the trajectory that's going on? Are you feeling better? Is that manifesting itself in your whole body? So that's like a great simple vital sign for the whole person to see, are you going in the right direction? If you're feeling better, I don't need to do more testing if there's nothing specific, but I do want to check and make sure that you're going in the right direction, that you're not kind of fooling yourself, or it can also be used as a means to be able to support that person, that, hey, you're going in the right direction, keep doing those changes in your lifestyle and your diet that are supporting you, because look here, we checked you a year ago and it said, you were equivalent to a 50-year-old. And now I'm checking you and you're equivalent to a 45-year-old. You've made these changes and look what's happened
Yep.
biologically. And that's really supportive. If that happens for me, then I'm like, okay, good. I'm validated in continuing to do these changes in my lifestyle. So that's a great monitoring tool. Other tools, I follow up if they're not all the way better. I'm missing something. Did I not find something when I looked the first time?
Now, when people ask you, how functional assessment different from traditional medical laboratory testing, like they go to a hospital to get blood drawn and they do testing over there, how functional medicine testing are different from them?
Well, the functional medicine testing is going to look at function first and foremost. It's
Right.
not looking for disease. It's looking for imbalance.
Okay.
So if we're looking at, say, for example, digestion and the gut are very, very important. And so most of the patients who I see who come in, I do some kind of stool testing with to find out, is your process of being able to take in the food and be able to digest it and absorb it,
Sure.
and have the right balance of gut bacteria, is that working properly?
Sure.
I can see the picture of how the function is working. Does your digestive function work? Absorption function work? Do you have intestinal permeability? Do you have issues that are going on with your gut flora? And when I see those imbalances, I work to treat those as root causes. When I do that, people start to feel better because they're taking in, they're actually able to use the nutrients that they're taking in. Their gut bacteria are not fighting against it. They're decreasing the inflammation in their immune system. They're
Right.
feeling better overall.
Right.
So functional testing is not trying to look for disease. None of those things are diseases.
Okay.
They're just functions that are out of balance.
Okay.
So we want to look at, and that's why we use this term functional medicine, because we're trying to look at the function. We're not inherently, Western medicine classically is good for looking at disease. But, but functional medicine is trying to go upstream and say, why should we wait until you have a glucose level that is so high that now we call you diabetic? If your glucose level is a little bit high, and then we look at other things like inflammation and how you work with cholesterol and lipids, we can say, oh, we're not going to wait until you have diabetes. We can see that you're on the direction towards diabetes. Let's help you now. And we have tools.
So people understand this also. Isn't it true that all disease manifested either, one, early on as an imbalance of function, and two, when you have the disease, you have it because of imbalance function.
Right, exactly. So it's a continuum that's there. So actually the same kinds of tools can be used for disease when you're far down the continuum as they can early on.
To prevent.
Yeah, it's easier to do it earlier in the process, but often
Also effective.
also effective, and frankly, many times people don't go to see the doctor, or they're not motivated until
So
they're
it happens.
feeling sick.
Right.
Yeah, so, but all functional assessment can give people some sort of alert, even they don't feel that whatever illness is, but the number tells that you are at risk.
Right.
So you need to go do some sort of treatment.
Right.
Okay. Now, what kind of tests are more popular than others in functional medicine testing?
Well, I mentioned one already. So stool testing,
Stool
which
testing.
is very unique and was, really developed through Great Smoky's Diagnostic Laboratory, where that laboratory at this point in time is still the largest, stool testing laboratory in the world, as far
Okay.
as I know, and so that can help to,
Strange thing to be known for, isn't it?
it's.
What lab?
It is,
Poop
but,
lab?
Biggest poop lab in the world.
but it opens the door, and that's
Yeah.
really, for me, kind of the first best test to be able to use. There's other testing that has been developed looking at food allergies, looking at permeability, all things that relate to the gut. And then I particularly like and think it's an amazing test is looking at stress, looking at the variation of cortisol that happens. It's easy to do a salivary test, so someone can take 4 measures of cortisol
Sure.
and evaluate that over the course of the day, and that
Right.
really tells us about how well are you responding to stress.
Mm.
Some people are wired, and some people are really tired.
Wow.
And in that, that's going to change what is the treatment that we do to help support that person.
Mm.
So those are some of the, I think, the hallmark kinds of testing that can be done. And there's other tests that, focus on nutrition as well.
Well, we're also doing lots of lab testing in this country. The biggest problem for China now to develop functional medicine practice is we need to have a good laboratory support. So as we are doing this kind of laboratory testing development, we also realize that we don't just develop one marker to do one sort of assessment. We always combine these markers and do a sort of an integrative analysis. Now, isn't this something that in functional medicine testing, this is quite pioneer and different or more advanced than hospital laboratory testing? And if that's the case, what would you suggest us to do if we want to really get these things developed in China?
I think it goes to the whole systems approach and systems thinking. And I've had doctors ask me this kind of question before, and I try to relate it back to something that they do know. So when I was in training 30 years ago, and we began to talk about heart disease, we talked about cholesterol.
Okay.
And we talked about total cholesterol.
Sure.
Well, then about 5 years, 8 years after that, people started talking about LDL and HDL cholesterol. Then spending more time talking about triglycerides.
Yeah.
Then talking about subfractions of those. Then talking about the relationship of inflammation in the whole thing. And now there's other markers that help us to see about coagulation and other pieces. So the doctors who are the cutting-edge cardiologists, they're using a wide variety of systems biology testing to
Sure.
understand the risk of heart disease.
Sure.
So it is used
Okay.
in standard in common medical practice right now.
Sure.
When we look even at something like a comprehensive metabolic profile,
Sure.
there's 17 different markers that will tell us because they give us a picture, but they're giving us a picture of disease, not really dysfunction as yet.
Yeah.
So there is the opportunity to be able to relate the concepts of we need to look at the whole picture.
Sure.
If I'm going to look at a hormone, well, there's a number of different hormones that are in the body.
Right.
Why would I just pick one hormone and make a clinical decision off of that, when the relationship between, for example, estradiol and testosterone and progesterone are very important? Why
Yeah.
would you just pick one to look at? Or cortisol and DHEA? You need to see them in relationship to each other. So I think the concept of systems approaches
Sure.
are already built into medicine that
Okay.
people can understand. Then it becomes really an educational piece of, well, why, for the doctor, why do I care?
Mm-hmm.
And then, unfortunately, but it's true, make it as simple as possible so
Sure.
that I can understand what my decision is that I need to do, of how's it going to affect my treatment. And that's where the kinds of colored reports and using logic and algorithms to help give the doctor to say, this is what this means,
Yeah.
do this. That's not so much what functional medicine in its origin was based upon, because the work of Dr. Jeffrey Bland and others are saying, let's teach people how to think. And most clinicians are working in a busy clinic and they say, it's a great idea, but can you just tell me what I need to do so I can help my patient? And quite frankly, that's what I did. And I would call the lab and they would say, this is what you should do. And I would do it and they would get better. And kind of much to my surprise, when I was on the other side and people were calling me and they say, what should I do? And I would say, do this. And then they would call me back and they would say, wow, the patient got better. And I would think, wow, this is really about my, using these tools. It's not about me knowing the answer. I'm just reading the tools and they're telling me what to do, and it works.
Wow.
Dr. Hyman said something similar this morning. He said, you know what? He said, I'm not a great doctor. He said, I'm a good doctor. I know how to use these tools. And if any kind of good doctor, uses these tools, they'll end up being considered by their patients a great doctor. Yeah.
Yeah, that's very, very important. Now we're in China. Once again, we're in a big city, big country with lots of chronic illnesses problems. What would you suggest the country to do using functional medicine to improve the health of the people here and perhaps help the healthcare system here?
Well, I think, the first thing is to work to help support the doctors and the healthcare practitioners who are interested in saying the way we've been doing things isn't working very well.
Mm-hmm.
And here's a way of looking at it, of looking at function.
Mm-hmm.
And our role is, how do we help support those doctors to really be able to do that in practice? As we've talked about briefly, there's a kind of a relationship between a functional medicine approach and traditional Chinese medicine. It's kind of a bridge between traditional Chinese medicine and Western medicine because it focuses on function and imbalance. And so what I suggest and what I want to work towards is helping to find the best way to educate doctors in China about functional medicine and making it very practical for them.
Okay.
Not a concept, but just very practical. What can you do in your practice that will make a difference to your patients? And as they start to do it, they'll find that, as I did,
Mm-hmm.
it works.
It works. Wonderful. Well, once again, thank you, Dr. Hanaway, for coming such a long way to China and doing training and also joining my program here.
Yeah,
And
absolutely.
Dr. Berry, thank you as well.
Welcome.
Okay.
Pleasure.
Thank you so much
All
for
right.
inviting me and for having a chance to get together again.
Sure. Great. Okay, that's it.